My name is Senator Gene Yaw. I'm the chairman of the board of the Center for Rural Pennsylvania. With me are several of the members of the board, and I'll introduce them in a minute. The reason for this conference today, or this press conference, is to release a report which the Center for Rural Pennsylvania has prepared. And the caption of that report is Heroin: Combating This Growing Epidemic in Pennsylvania. If you recall, about a year ago, the center did an initial report, that's this one, on the general broad problem and what is being done in Pennsylvania and the impact in Pennsylvania. We had input from various social agencies, law enforcement, just across the board, healthcare. What we did, that report was probably the most comprehensive report that's been done with regard to the heroin problem in Pennsylvania. The acceptance of that report led us into another series of hearings. The first in 2014 was based on 4 hearings that we had throughout the state. In 2015, we did another series of hearings, and we tried to focus on treatment and recovery and what's being done in Pennsylvania in that regard. And that is the report that we're releasing today. And I think that these reports, as I said, there's no doubt about it that these are the most comprehensive reports that have been done on this issue in Pennsylvania. I'd just like to talk a little bit about the Center for Rural Pennsylvania. The center is it's a joint legislative agency of the House and from the House and the Senate. It's bipartisan and bicameral, and it is governed by an 11-member board of directors, and many of them are here today. The people that are here, I'd just like to introduce them. Obviously myself, Senator Wozniak, Dr. Nancy Falvo is the secretary from Clarion University. Representative Garth Everett is the treasurer. Representative Sid Kavulik is a member. Dr. Ted Alder from Penn State University. Dr. Livingston Alexander from the University of Pittsburgh. Mr. Taylor Dobler, who is a citizen representative from TA Seeds in Avis, Pennsylvania. And Mr. Steve Brame from the Pennsylvania Rural Electric. These people on this board, traditionally what the center's mission is to do research and data on issues that affect rural Pennsylvania. This was kind of a different approach, and I want to thank the board for having the foresight to say we're going to do things a bit differently. Rather than have other people do research for us, we're going to get involved in this, and we're going to do this ourselves. And one of the issues the primary issue, the way that this got started actually was Senator Judy Schwank, who is also here today, raised the issue with myself and Barry Dank, who's the director of the center, as to can't you use the Center for Rural Pennsylvania as a vehicle to raise the awareness of the drug problem in rural Pennsylvania. So actually, she's the one that's responsible for the impetus to get these programs going or get these reports going. I think that, as I said, last year we did a series of 4 hearings. This year we did 3. We did them at Latrobe in Westmoreland County, at the Commonwealth Medical Center, in Scranton, and in York. If you want a primer on the drug problems in Pennsylvania, I suggest that you might, these are all on my website, and the reports obviously are on the Center for Rural Pennsylvania website. There's about 40 hours worth of presentations and testimony from people across the board. It's from law enforcement, from healthcare, doctors, colleges, social workers, just about virtually every agency that you could think of that has any input into the drug problem. One of the things that we found out, and there's just no question about it, that the loud and clear message was that addiction is a chronic disease, and it's got to be recognized by the public, by government, law enforcement, and every medical suppliers and everybody else as being that type of a problem. Treatment and recovery services have to be developed. They've got to be coordinated, funded, and provided in recognition that this really is a disease. It's been stated many, many times, and I've used this example hundreds of times. If somebody has diabetes, you don't send them away for 30 days or 60 days and they come back fixed. And drug addiction is the same. It's the same problem. It's a lifelong problem, and it is a community problem. Treatment can come from many forms, whether it's inpatient, medication assisted, but the most important thing, it has to be long-term, it has to be community-wide, and it's, as I said, it's continuing. Our report, the actual report today, I think it points out, and I'll just hit a couple highlights and just kind of summarize them. First of all, we have a system that's very fragmented. We have a lot of programs, but they're all over the place, and somehow we need to get them coordinated. We need, there's no question about it, we need some sort of medical education, whether it's continuing medical education or actually teaching in medical schools in Pennsylvania about the problem with prescription drugs and opiates and pain management. We need to address the issue of naloxone, probably more than, a little bit more than what we have. Naloxone is an opiate antidote, which is now being carried by the state police. I know one of our charts over here indicates that there have been over 450 saves with naloxone. And whether you think that somebody who has overdose should be saved, kind of the touchstone is this. You know, you can't save somebody if they're not alive, or you can't treat them. So, you know, that we need to, at least the first step is to save them. We also ran across problems with, we need some kind of standardized reporting for coroners. Coroners look at things differently, and it's not their fault. I mean, it's just we need to, if it's a drug overdose, then we need to keep track of them and not designate something as heart failure. So those are the types of things in that area. Law enforcement has told us how important mandatory minimum sentencing is, that's a tool that they use, and there's some question about that now and the status of it in Pennsylvania, and that's something that we need to talk about. Most importantly, I think that one of the things that a phrase that came up repeatedly throughout what we were in our hearings is there has to be a warm handoff. And the warm handoff is that if you go from an inpatient treatment, you just don't stop at the end of it. It has to go on. There has to be this continuum of care. And we were told repeatedly that faith-based programs are very, very important for long-term recovery. While this round of hearings is over and we're releasing this report today, the work to address this public health crisis, and it really is a crisis, continues, and we can't fade. All you have to do is stop and think about it. There are 2,500 people a year in Pennsylvania die of drug overdose. 7 people a day. So 7 people today are going to die of a drug overdose in Pennsylvania. And while we originally started off looking at rural Pennsylvania, what we found out is it crosses all socioeconomic groups, all races, all ages. Nobody is free from this problem. So with that, I'd like to introduce my vice chair, Senator John Wozniak. John, you have any comments?
Thanks, Senator. I want to thank Gene because it was through his insistence with Barry Dank and Barry Dank's staff that carried this all forward to really take this challenge on. We had our first set of hearings. It was to learn the who, what, where, and why of rural addiction and what was really going on out there. The second one is more of a direction of what steps can we take to help alleviate, because we will never solve the problem. I sit on the local government commission. Sort of interesting because of 253 members of the House, 50 members of the Senate. Everybody has their own concepts out there, but we use that commission as the central clearinghouse, and if a local government commission bill comes through there and gets a good housekeeping seal of approval for local government commission, there's a good chance it gets to the governor. What I'd like to challenge Barry Dank and his staff now is, as these 253 members of the House and the Senate start putting their ideas together, is to use our Center for Rural Pennsylvania as that central clearinghouse, because, and then we could maybe put that good housekeeping seal on a number of bills that we think and feel are most important. It is remarkable that this center has done such a yeoman's job out there. But I think that the next step is now, what do we need to do? And I'll tell you, my opinion changed. I oppose the creation of a department level of alcohol and drugs. I thought it was a wrong step or a wrong statement for Pennsylvania. But it's created. And the most important thing we can do with that department now is to fund it and listen to the secretary. Secretary Tennis is a relatively intelligent man, and, well, he is an intelligent man. But, right. And fully understands. But I think we need to have a multifaceted approach. One is the long-term treatment of addictions. Let me say something clear. Not everybody that's hooked on drugs is a worthless junkie. It's somebody's son, daughter, mother, cousin, and everybody listening right here has been affected by it. We want to get rid of the no-goodniks out there, the people that addict our families and our children and our loved ones, and obviously to go up the food chain. But I think the first thing, and I worked on some legislation now, is education. Awareness, knowledge equals prevention. And the best thing we can do, and probably the best bang for your dollar, is to do what we can to prevent. Next to that is, how do we deal with treatment, starting with the infancy of the addiction, where it's easier to treat. So there's a journey that we need to take, but the Center of Rural Pennsylvania has really made a difference. It made a one-stop shop, and there's probably no more articulated concept than what came out of these two studies. And so I want to thank the board that spent those many hours at hearings, and I want to thank Barry Dank and his staff for the tremendous time and enthusiasm they have shown. And I think out of this journey, we will be able to help Pennsylvanians, help families, reduce deaths, reduce crime, and put the bad people behind bars. And I think that's what the public wants, and hopefully we can accomplish that goal over the next few months with legislation. Thank you. Gene?
Thank you, Senator Wozniak. Another person that has been very instrumental in attending the hearings is our Secretary, Dr. Nancy Falvo from Clarion University. Dr. Falvo.
Thank you. Thank you very much. I'm a nurse and an educator. I represent the faculty from the Pennsylvania State System of Higher Education as a member of the board. And I did attend the hearings last summer and this summer. I found them very informative, but also very frightening. We heard several messages over and over again, and one of the most disturbing, as Senator Yaw had said, was that heroin does not discriminate. It is not geared towards only young, poor individuals living in overcrowded urban settings. Heroin doesn't care if you're a male or female, if you're rich or poor, if you're young or old. There are no boundaries. We are seeing addicts across all socioeconomic conditions, in unemployed individuals and in professionals, in rural and in urban areas. In most cases, individuals first become addicted to prescribed pain medications and then switch over to heroin because it is cheaper and it is easier to get. I had one individual tell me that if we gave him $15 in 15 minutes, he could be back with 3 bags of heroin for us. So it's the access is unbelievable now, and we were in a very rural area. During the hearings, we heard a lot from recovering addicts, and yes, there is recovery for many of these individuals, from parents, from rehab professionals, from law enforcement and healthcare providers. It is very important that we recognize that heroin addiction is a chronic disease very similar to what alcoholism is, and how we have gone through that route of classifying it as a chronic illness and for our physicians and our nurses and our healthcare providers. Chronic disease cannot be fixed, it can't be cured. We do know, as we have heard already, that the 30-day treatment plans do not work with heroin addicts. We need to be inventive. We need to look at new and alternative therapies. Pennsylvania, like the rest of the country, is in the midst of this horrible epidemic, and we need to acknowledge this and move forward to create new and different treatment modalities that provide the best hope for these addicts and their families. We need our healthcare providers and pharmaceutical companies to have more education regarding pain management and alternative therapies to control pain rather than prescribing an opioid. And we need to be certain that our first responders on the scene of an overdose are carrying naloxone and are comfortable, qualified, and prepared to administer it. But we must also have that handoff, as you have already heard of, that provides a treatment facility, an ER visit, or even an inpatient bed to initiate that treatment. If you think that heroin isn't everyone's problem, I'd like to tell you this little experience that I had. Last week, I was at a fundraising event and sitting at a table with 8 individuals. One gentleman apologized for being very quiet that evening and said that he, that very day, had attended the funeral of one of his very good friends' 24-year-old son. The young man had been in jail for a drug arrest and had been out 10 days, and his father came home to find him with a needle in his arm, dead. There was a teacher sitting at the table, and she then told us that she had a young student who this Christmas was going to be in foster care. Both of her parents were heroin addicts. The father, who she had been living with, had been arrested in the fall and was in jail, and the mother was nowhere to be found. One of the nurses sitting at the table told us that her co-worker's sister had died of an overdose in the spring. She had been living with her, having come out of rehab, and they did not have naloxone in the house, and her sister overdosed before and died before the responders could get to her. And another nurse sitting with us talked about a co-worker who had just lost his license, having become addicted to opioids after knee surgery. So this is everyone's problem, and I encourage you to take your part in helping with this problem by continuing to educate individuals in the Commonwealth about what the problem is and what we can do to fix it. Thank you.
Thank you, Dr. Falvo. One of our other officers is Representative Garth Everett. Garth?
Thank you, Senator. And I'm not going to be repetitive. The other officers have covered the territory quite well. I just think one of the things that that we did learn is how hesitant families and friends are to come forward because of, and we heard it at a number of hearings, the word stigma. You know, we've kind of touched on it. Some of the other officers touched on it, but because of the stigma of being addicted to drugs, that would classify you as a lowlife or a loser. When it is happening to folks from, as we said, from all stratus of life and all walks of life, all races, and it is, I think, that stigma that makes people hesitant to bring themselves forward and admit that they have a problem, and I think it's through education. And that's why we're relying on the media to get that word out that it is a disease. It's not necessarily the individual's fault in any sense that they become addicted. It's the drugs, the new opioids that are prescribed are highly addictive, and it doesn't take much until you find yourself in the spiral, and the drug takes over and it starts to rule you instead of you ruling the drug, and the next thing you know, you're on heroin, and the next thing you know, you've overdosed and you need your naloxone, and you do need the continuum of care and everything that we've talked about. It's really it's one of those things we talked after we'd have our hearings and say the more we learn about this, the more depressing it can become. But we did hear from folks who are recovering, and I don't think you can use the term recovered. They're all recovering, and they understand that it's always out there, and they'll be with it for the rest of their lives. And we need to make sure that they do have the support, the continuum of care, and the things that they need to be successful. And again, I want to thank the staff. We show up at the hearings, we listen, they write the reports, they do all the great work for us, and I want to thank them for all the hard work they do. And we're going to continue to pursue this. I think we've identified some things that can help, and we'll do what we can legislatively. I don't think we can legislate this problem out. We can't arrest it out. We can't incarcerate it away. It needs a holistic approach to help the folks that are having the problem, and we'll do what we can to make that happen. Thank you.
I'd like to give any of the other board members the opportunity to make comments, because they sat through this. They were the people that authorized us to go forward with this. So, Representative Kuwilik.
Thank you very much. I think over the course of the hearings that were conducted, my eyes were open to a lot of things, as I think I could safely say all of our members were, to some things that we didn't realize. Education, how important education is, from the person who is using these drugs to the person who is prescribing these drugs to the people who are around, who surround, who care for these people that are caught up in these addictions. The young athlete who, high school football players, high school basketball players, college players who are injured and are prescribed painkillers and eventually get hooked on these painkillers. I had an interesting incident occur in my office where a gentleman came in after our hearing in Scranton and talked about his wife, who had a very successful business. She was on her feet all day, started having back pain, went to the doctor, was prescribed painkillers. She got addicted to these painkillers, just trying to keep her business going. Eventually, because of that addiction, she lost her business and nearly lost her marriage. So as Representative Everett said, we can't, law enforcement, incarceration is not the answer. We need education, we need patience, we need to continue the work that the Center for Rural Pennsylvania has done, continue to expand on this, continue to move forward with this so we can get a better grasp on this problem and help so many people who need it, and stop this problem or curb this problem as much as we can here in this Commonwealth. Thank you.
Anybody else? Thank you. At this point, if anybody, we'll take a few questions if you have some. Yes, sir.
How close do you think we are to being able to fund this vast level of treatment for all these people that need it, like down at the county level, and also, providing this new long duration of treatment that we now realize is necessary?
That's a good question. I don't think that we've ever looked at it and recognized how deep the problem is, how ingrained it is in our society, and what we need to do, the funding that we need to come up with to address it. I don't think there's any question, and we're going to have to look for more funding to address it. And that's one of the things that came out of this. We have the facilities in the United States that, the resources to treat about 1 in 10 people that need to be treated. Pennsylvania is actually a little bit better. We treat about 1 in 8, but that still leaves a big gap. Yes, sir.
Senator, there are a lot of recommendations. 11 of these are very complicated issues. Where's the room for the most impact, or where's the room for something that needs to, if you had to prioritize, where would you put priority first?
If I had to prioritize and I'm starting from scratch, I would start with some way to coordinate all the various programs that we have out there. Because remember, I said right off the bat, one thing we found out, there are a lot of different programs. Now, we need to coordinate them to get them together so that they're not repetitive. And to tell you the truth, we ran into the problem, and people have told us we used Project Lazarus in North Carolina as kind of a guide. And the person, Fred Brayson, is the director of that program, helped us a lot as far as what we would run into, what you could run into, the problems. Territoriality is a problem, and I guess that's natural. You know, everybody wants to protect their own turf. They think that their program is the best one. But it may be the best for certain things, but it's not the best for all things. And we even ran into it with the issue with faith-based, with churches. One church has a program that's really good for drug recovery. Well, somebody else wants to duplicate it, but why duplicate it? Why do that? It's very inefficient, you know, and it's a waste of resources. So if I had to concentrate on one thing, it's like getting all these things under one tent, frankly.
And, you know, I talk with a lot of experts. I think everyone would agree that all these recommendations are good recommendations, but I think many people would say a lot of these are tough. You know, establishing a uniform manner to report overdose deaths, that's pretty tough in 67 counties, and I've done a lot of reporting on that. How much confidence do you have that these are going to happen?
I don't know. Our intent was to report what people told us, and that's what these were the recommendations that came from the people who came before us. I mean, we didn't go through things and come up with these, the center or our staffs on our own. I mean, these were issues that people presented to us that they would like to see addressed. You know, some of them can be, some of them, you're absolutely right, they're going to be tough. Anybody else? Yes, ma'am.
What's the next step after this report?
That's a good question also. I don't know. I thought if I suggested we were going to have another series of hearings or something, the Center for Rural Pennsylvania staff and my staff would probably faint. But there's a lot of work involved in these. Our goal originally was to raise the awareness of the problem in Pennsylvania, and specifically in rural Pennsylvania. You know, I hate to say that we've ever accomplished that goal in full, but compared to what it was when we started, just seeing all of you here and asking questions, I think that we have done that. We've accomplished one of the things that we set out to do. One of the other things is like we found that throughout the state, you know, the problems are the same. So at least by having these reports done, hopefully we've saved people a lot of time and trouble. If they read them, they don't have to reinvent the wheel. Where do we go from here? I'm not exactly sure. That's one of the things that we're going to continue to work on this area, though. There's no question about it. Even economically, one of the hearings we had, the president of the Pennsylvania Chamber of Business and Industry testified about the economic impact. So this is something that's there, and until we get control of it, it's something that the center is going to continue to work on. Yes, ma'am.
How quickly do you see some of these things? We talk about how it's an epidemic every day, 7 people are dying, and there's a lot of recommendations. How quickly can any of these be a reality?
Well, I think some of them are already, there's been some introduced in the House, and Senator Wozniak has introduced it.
Mine deals with the education, starting from 9th, 10th, 11th, 12th grade. Big believer in making young people aware what crimes and what the punishments are, and letting them understand what the consequences are has a big way of making that awareness. Once again, awareness, understanding, knowledge equals prevention. I think what we need to do on one end is to start with prevention, which is less expensive. And I'd like to go back to the gentleman and talk about the funding issue. We need to front load it because at the other end of it, every single person that we treat versus incarcerates slowly sets the tumblers in another direction. So we have to front load it a little bit, but every time you don't have that person in state prison, you're saving $35,000 to $40,000 a year. So if we can do this well and start reaching those people young enough, for the treatment where it's less expensive, the money can come from corrections in other places because we're actually saving money from not forcing people to go to the court system and then the correction system.
I think to follow up a little bit on what Senator Wozniak said, I recall that part of the testimony that we heard is 70% of the people that are in prison have a treatable addiction problem. Now, it may not be drugs, but it's a treatable addiction problem. Just think about that. I mean, the economics of that alone are tremendous. Yes.
Are there, of these recommendations, is there any legislation already in the works introduced that address any of these, or at this point, are these just ideas?
No, I think that there are some things being prepared right now, and that either some of them have been introduced indirectly in the House. Senator Wozniak says, as far as education is already in. We're preparing some. We're looking at the medical education issue. We're talking about the mandatory minimums and sentencings, and so all those things. I mean, it's going to take a while till they run through the process, but at least they're started. They are started. You know, there was somebody over here too. Yes.
To the naloxone issue, why isn't every police department already carrying that?
That's a very good question. I'm not quite sure why. There is, in some areas, there's a significant pushback that the police don't want to carry naloxone. There are several reasons given that they don't want they think that it's unsafe for the officers when somebody comes out, that they may be combative, that there's a mistaken fear of liability issues, and that was resolved a year ago with the Good Samaritan bill that we passed in the legislature. So I'm just not sure. Maybe it's a part of education also. They need to be educated and trained.
Is there anyone that's actively working to try and convince departments?
Well, I think Secretary Tennis is. Secretary Tennis and the Physician General, Dr. Levine, they're big supporters of naloxone being more available. It's not habit forming, and the only side effect is if you have that in your system, or one of the drugs, the derivative drugs of that is you cannot get high on an opiate.
One more question, Senator. I'll ask
You're
about
full of questions, yeah.
the bill in the House right now. I know it's early, but it wants to limit ER prescribing for opiates to, I believe, 5 days before you have to come back. Any thoughts on that? I know, the Medical Society is still taking a look at it as well, but that's a pretty stringent requirement. I know Massachusetts, I believe, has 3 days, 72 hours. Thoughts on that bill?
Since my office, we're talking about doing something similar to that. Yes, I think that, this is the emergency room treatment. This is not your family physician. So if you're in the emergency room and you have whatever it is, 5 days or 7 days of pills or pain medication, the place you should not be going back to the emergency room. So, all right, with that, we're going to end this, and I would like to thank all of you for coming and helping us get out the word about raising the awareness of the heroin problem in Pennsylvania. Thank you.